So, hello everyone. Today we are going to talk about a very interesting topic which is gout. So, what is gout? Gout is an inflammatory disease and which involves the deposition of monosodium urate crystal in the joint. So, as it is an inflammatory disease, so what are the signs and symptoms of the inflammatory disease? There will be redness, there will be increase in the temperature, the joint will be have swollen, the joint will be painful, it will be having tenderness. Okay, so these all symptoms comes with the gout, and it is also termed as a gout attack. Now let's talk about the term hyperuricemia. So as the term suggests, hyper means increased uricemia, that is increase in the uric acid. So there is too much of uric acid in the blood that leads to formation of this sharp crystal in the joint. Okay, over time, due to repeated gouty attacks which leads to destruction of the joint tissue, which results in joint arthritis. So hyperglycemia is nothing but it is the increase in the level of the uric acid in the blood. Normal uric acid in the blood is below 6, and if it increases above 7, which means you are having the risk of developing hyperuricemia and having the risk of developing gout. So, hyperuricemia can be caused by either two things, like two cause, either due to the overproduction or either due to underexcretion of urine. Either the body is producing excess uric acid, or either it is not able to excrete it. So, this will lead to abnormally high level of uric acid in the blood. So, now let's talk about the risk factors of the gout. The person who is already having any disease like diabetic person, or the person is having blood pressure problem, the person is having hyperlipidemia, these are the more prone to develop gout. Now next one is another risk factor: age. Older age, usually it happens in the older age. Male, like gender, male is more common to develop gout as compared to female. I'm not saying that the female is not having gout. Females also have chances of developing gout, but mainly it happens after the menopause, like postmenopausal, because during the postmenopause there is hormonal imbalance. Okay, while the females are like having less uh, risk of developing gout because due to presence of the estrogen hormone. Okay, so next factor is obesity. Obesity is also a risk factor of developing gout. Now another one is dietary source. Okay, the person who consume animal food, seafood, red meat, organ meat, these are having, or person who consume purine rich diet, these are having risk factor of developing gout. The person, dehydration also plays an important role. The person who do alcohol, okay, who take alcohol, or genetic factors, medications like diuretic and aspirin, these all are the risk factor for developing it gout. Now let's talk about the symptoms of the gout. So symptoms, I told you that it is an inflammatory disease. So inflammatory disease will be having redness. Okay, there will be swelling, there will be tenderness, there will be pain, there will be rise in temperature. Okay, so apart from this, what are the like clinical features? The gout mainly often affect the first metatarsal of the foot, that is the base of the big toe. This is the affected first. Okay, and this condition is known as podagra. Okay, in this podagra, what happens is whenever the person wakes up, the toes feels like on fire. It's very very painful, and the toes become swollen, and this symptoms can stay for about a day or even a week. And as well, gout not only affect the first metatarsal joint, it can also affect other joints like ankle, knees, wrist, elbow. Okay, now, if we talk about the pathology of the gout, as I told you, there might be two conditions: either under excretion of uric acid or either overproduction of uric acid. Both the condition will lead to elevated uric acid levels, and this uric acid levels elevated in blood will form the uric acid crystals, and these crystals will get deposited in the joint and connective tissue, and the person will have acute gout attack. This attack remains about 7 to 10 days. Okay, so now if I talk about the symptoms or treatment, if I talk about the treatment of the gout, what are the treatment? Basically, we will focus on the pain and the swelling first. Okay, so for pain and swelling, what we can do? As a physiotherapy management, we can use a cryotherapy for pain and swelling, maintain proper range of motion of the joint, maintaining strength and function of the joint. Weight management can be given, as obesity is a risk factor of developing gout. Splinting and other assistive device can be given to the uh, affected joint to protect that joint, okay, from further deformities. And certain pharmacological management can be like NSAIDs for management of pain and swelling, like example ibuprofen. Corticosteroids can be given. Certain dietary modification should be provided to the patient, like asking patient to be well hydrated, avoid high sugar diet, eliminates soda, alcohol, red meat, seafoods, staying active, ultimately avoiding obesity. Okay, certain like inhibitors which decrease uric acid levels, like xanthine oxidase inhibitor, can be prescribed to the patient. Okay, so if the gout attacks is repeated, it will lead to chronic gout. Okay, and this will cause permanent joint deformities, tissue destruction, and further it can lead to a condition called urate nephropathy, that is crystals in the kidney interstitium. This is very risky and it increases the risk of kidney stone. So, urate lowering therapy can be provided to the patient. How we can diagnose if the person is having gout? So, for that, we can go for synovial fluid analysis. The MSU, that is monosodium urate crystal identification, can be done in the synovial fluid obtained from the affected joint. Okay, so as I told, what are the treatment dietary intake, like what can be given to the patient who is having gout? Green vegetables, green fruits, vitamin C intake, fresh berries can be taken, physiotherapy, physical exercises can be given to the patient. Now let's talk last about the stages of gout. There are four recognized stages of gout, namely asymptomatic gout, acute gouty arthritis, interval or intercritical gout, chronic gout. So first one is asymptomatic hyperuricemia or asymptomatic gout. As the name suggests, asymptomatic, which means it will not having any symptom. So in this stage, there is when someone develops hyperuricemia, a condition where there is high level of uric acid in the blood, the body become acidic, but there is no symptoms present. Okay, at this stage there is no treatment required, no medication is required. But if a person is diagnosed that there is high level of uric acid in the blood by the blood test, uh, immediately that person should change their diet. Modification should be done immediately. So next one is your acute gouty arthritis. Acute gouty arthritis is the very first attack, first times. It is very painful, and this increases next 8 to 12 hours and making person or patient very difficult while walking. There is very pain, and this usually attacks the big toe, as I told you earlier, and the patient feels like there is broken, the foot is broken. There will be signs of inflammation, there will be reddishness, there will be increase in the temperature of that area. The person might experience light fevers or even chills. You may find this like symptoms get resolved after 3 days, but like some relief will be there, but the symptoms will be there up to around 10 days sometimes or longer, depending upon the patient. Now, what is the next stage? That is intercritical or interval gout. Okay, so as the name suggests, it should be having intervals between them. So this is the period of time in between gout attack where you feel no symptoms and your joint function properly. These attacks are more fatal than initial attacks and can include different joint area. The last stage is chronic gout, or we can also call it as chronic tophaceous gout. Okay, this is the last stage. With proper treatment, no gout progress to this stage, and this is very life threatening and irreversible damage occurs to the affected joints. It may damage your kidney and it may lead to person's death. This usually occurs after 10 years if a disease hasn't been treated properly and no lifestyle changes were implemented. Okay, so that's all about gout. Hope you like the video. Kindly like and subscribe to my YouTube channel. Thank you everyone.